I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com with another episode of Terpene Talk. This time, easier to pronounce terpene, Sam. It's going to be limeolene. Got it right that time. Limeolene is a common terpene. It's found in many different cannabis strains. Now, it's found in a lot of other plants, just as most terpenes are. It's found in lemongrass, a lot of citrus type fruits. It has a real fruity, of course, a lemony scent to it. Now, as with most of the terpenes, limeolene does have antibiotic and antifungal properties to it. One of the nice things about limeolene is it is one of the non-sedating terpenes. Almost all the terpenes are central nervous system depressants. This is one of those sativa-like terpenes that will not really shut you down as far as slowing things down. It actually elevates people's mood, helps with anxiety and depression. It's not likely to cause anxiety as one of the other sativa terpenes, pinene, we mentioned did. It's also been found to be effective in symptoms of heartburn and gastroesophageal reflux in patients. It's been shown to increase skin penetration of both cannabinoids, other terpenes, as well as some other drugs, making these topicals more effective as they penetrate deeper into the skin towards the target tissue. These, limeolene in particular, decreases anxiety, which sometimes occurs with high doses of THC. A typical home remedy people may be familiar with is to use very concentrated lemon water if you do experience untoward side effects from a high THC dose. This is due to the anxiolytic, anti-anxiety effects of the limeolene. Limeolene also has anti-cancer properties. It can increase the cell death of certain types of tumor cells relative to the normal cells, and even in experimental studies at any rate, cause the redifferentiation of cancer cells back into normal cells. Limeolene also blocks the carcinogenic effects of tars that are produced when herbal cannabis is smoked. These tars can cause cancer in some patients. Limeolene has been shown to block that process. The other thing limeolene may have an effect on is acetylcholine levels in the brain. Now, acetylcholine is a neurotransmitter that's important in memory. A lot of times in Alzheimer's patients, we'll see decreased acetylcholine levels. It is thought that high doses of limeolene may be of benefit in these patients. So who should consider limeolene dominant strains? Well, anybody looking for the sativa-like effects without getting any type of anxiety really should look at limeolene because it won't be sedating at all. Any patients who do have anxiety and depression symptoms, limeolene, of course, will help with that. Anybody that has gastroesophageal reflux, it's very effective against this. And it should be considered as a preferred dominant terpene in patients with breast cancer. Always look for limeolene in your topicals as it will improve the transcutaneous across the skin penetration of cannabinoids and other medications. Our friends at Buffalo Company already know that and mix lemon haze terpenes into their topical products for exactly that effect. For more information on all things medical cannabis, check out our website, CannabisExpertMD.com. We're also available on Facebook, Instagram, YouTube, and Twitter under Cannabis Expert MD.